Good to have you with us here at 4 o'clock, and we start this afternoon with sobering, startling insight into the cyber attack that hit Ascension St. Vincent this month. It's forcing the hospital to rely on paper records and manual procedures.
And now we are hearing from people on the front lines calling the consequences of that cyber attack a crisis. Our Karen Campbell talked with a traveling nurse worried about patient safety.
Justin Nizer has been a nurse for 13 years.
My mom is my inspiration for going into healthcare. She's a nurse as well for about 30 years.
A traveling nurse for the last 3, most recently working at Ascension St. Vincent in Indianapolis.
I was working the day that it happened.
May 8th, the day the hospital system was hit with a cyber attack, disabling all systems.
We couldn't print forms out. We didn't have medication records for patients. It was just a lot of confusion.
Now, 3 weeks later,
there's still a lot of confusion, and this is like a daily confusion.
Nizer says physicians must write onto medication records.
Sometimes they're reconciled wrong. Sometimes patients may be getting wrong medications, or the medications might be the wrong route, maybe oral to IV.
Another concern, keeping accurate patient records after hospital stays and managing patient documents.
The issue is when these charts are thinned out, they're taking the physician orders with them. So now I have a handwritten medication record, but I have no way to reconcile if these are the correct medications because now I don't have physical copies of the orders.
Leading to a stressful environment for many nurses.
A lot of nurses are scared because it's, you don't want to accidentally harm a patient by giving a medication that was already given or anything like that. It's just very stressful.
A spokesperson with Ascension St. Vincent tells us they have successfully restored their electronic health records in one location. It is unclear what location that is. They will continue to try to bring back systems, they say, on a rolling basis. In Indianapolis, Karen Campbell, 13 News.
All right, Karen, thank you. An Ascension spokesperson also tells us the doctors, nurses, and care teams are, quote, demonstrating incredible thoughtfulness and resilience as we use manual and paper-based systems during the ongoing disruption to normal systems.
And you can stay up to date on any changes within Ascension St. Vincent. They've got a whole web page dedicated to updates on how this thing is going. We'll include a link with this story. You can find it at WTHR.com.
And these kinds of cyber attacks, sadly, have happened to a lot of hospital systems.
Oh, absolutely. Yeah, it's a big
they're not
problem
alone
across the country.